we kind of wanted to start with the topic and just discuss what it takes, what kind of qualities and characteristics does it take to work in the behavioral health field.
Yeah.
Um, we both have been in the industry for a long time, and so I think we have a good idea on the different qualities that you need to have to sustain and be in the field long term. And
Absolutely.
and so yeah, what have you seen?
I mean, for me, the first thing that comes to mind are I call it the three P's, but persistence, perseverance, and patience. Those are the things I think of because uh, I've seen over the last 25, 30 years that those are characteristics and attributes that will help an individual be successful. This is not an easy field to work in. It's not an easy field to, I guess, feel like you're an expert in because there's always something new. There's always something that we're looking to be challenged by, and so being able to persevere through the difficult things and the difficult trials, but also having patience with yourself, with your clients, with your families, with um, your stakeholders, the community. Um, yeah, I mean those are three words that kind of stand out to me. What about you?
What have you seen? I'm just curious because what kind of experience? Because you've been on the front lines. I know in Las Vegas you worked for a company. You did PSR
Hmm.
services, and kind of walk me through some of the experiences you had with different individuals, and maybe difficult situations where you're like, is this for me? Do I really want to do this? And what kind of pushed you through to say, hey, this is, no matter, what experiences I have, I want to stick with this because there's more meaning to it than just.
Yeah, I mean another one of those words is passion. I think I was working with an individual. This was several years ago, maybe 8 to 9 years ago, and we were in a one-to-one setting, and she just was working with her therapist and then working through some psychosocial rehab with me. She got to a point in her therapy where she was dealing with some major trauma that had happened during her youth. And so there was a point where she was just like, Andy, I'm done. I can't do this anymore. I I think what you're pushing me to do is too much, and I rather just be homeless. I'm done with this. And she was in her young 20s. And so then at that point, to me, it was about persevering through, like, forget the method and just base work on the relationship with her. And so we just backed off all of her skills at the time, and we really focused on developing a relationship, getting to know each other, making sure that there was like a foundation of trust and of rapport. And I think that took, I want to say, about 4 months. And I mean sometimes all our sessions were only 15 minutes and that was it because that's all she could do. And so, but I was still going to give her those 15 minutes and she was going to give me what she could. I don't know if some other frontline after 4 months would have been like, okay, just give me another client. I'm done. This isn't going to work. But eventually, she was able to work through some things and know that I believed in her, so she could believe in herself. And I think that was the kind of the change for her. And as a frontline, as a facilitator for skill development, I had to know that it was not my timeline; it's the client's timeline. And so I had to back off of identifying a timeline based on what I thought she would need. And yeah, 4 months was way longer than I thought with those little touch points every couple of times a week. But it we got through that time. And then we started up our services again at a more intense level. And then she was able to kind of just take off from there. I mean,
Mhm.
she got her driver's license after that. She became a truck driver after that. She met some of the goals that she had for independence that seemed so far off during those 4 to 6 months. And so I think from a frontline perspective, just trusting the process,
Hmm.
having a relationship with your client, um, and just persevering through what seems like just a very tiny, minute progress. It will happen eventually. But at the end of the day, it was our relationship together that got us through.
Hmm.
And yeah, so I think just being able to be
What
patient.
what um what drove you to want to develop and create a relationship with her? Because a
Mm,
lot of people don't have that desire to want to try to help and develop a relationship with someone that they might perceive as a lost cause,
mm.
or this is too much, there's too much work that needs to go into this, that she's already an adult, like there's no hope. What kind of drove you to say, hey, you know what,
Yeah.
this is worth it to try?
I mean, I I've seen firsthand by experience how having belief and having faith in a situation or a person can push them to do something that they normally would not. So I've actually had that experience. And so I think for me in those situations, I think it's having that optimism of growth and knowing that there's going to be another option. There's more than just um, a lost cause for someone. There's so for me that push and that passion and why I see that is because I've seen it in my life, experience it myself, and I had faith and I actually believed in this because I saw incremental growth with this particular individual that I was working with, and I saw that she was able to do some things that she didn't expect herself to do. And so because I believed in her, she would say, "Well, I don't believe in myself, but Andy believes in me." And that's all she needed. And so when I heard that, that resonated with me. And so I just wasn't going to give up on her.
Mhm.
And why? Everyone else in her life had given up on her. Why
Yeah.
should I?
Right.
That wasn't helpful to her.
Yeah.
It took her down a dark path. So
Yeah.
she needed someone in her life to believe in her. Why not
and
me?
and how often do we see that, where individuals from a young age have developed that behavior pattern
Hmm.
to sabotage a relationship? They're going to do everything in their power to push you away, to validate, hey, no one loves me, no one cares about me,
Right.
and they'll go to great lengths to try to sabotage that relationship. I mean, we've seen it: property destruction,
Exactly.
aggression, manipulation, whatever the case may be. And so, do you think kind of having that understanding of that might be their core belief kind of helps push through that relationship? Have you noticed that? Have you noticed individuals that kind of have that self-sabotage behavior to try to validate, hey, they really don't care about me?
Absolutely. But I think knowing that and being educated on that helps going into it for our front line. I mean,
Mm-hmm.
we can educate and we can teach to that.
Mm-hmm.
Um, I I I would always say, "Oh, I only got called a certain name 10 times today instead of 20. This is a good day."
Yeah.
And so the further they would try to push me away, the more I would stand firm and say, "I'm not going anywhere.
Mm-hmm.
You can call me names, I'm not going to react." And I think over time it showed this individual and other individuals I've worked with that they're worth something. I think
Mm-hmm.
that's what it comes down to is that they have worth.
Right. And with this particular woman that you're talking about, did she have a history where maybe she was abandoned by her parents, or what was her history growing up to what that might have led her to where she was at in her life? Did she
Yeah.
have certain experiences that led her to that point?
Without going into too much detail, she had endured some very horrendous abuse, physical and other types of abuse, and had been in 12 different foster homes
Mm,
before 15 years old.
wow.
And so she had burned through relationships and, um, familial relationships were just not there for her.
Hmm.
And so, yeah, she had definitely seen that if she pushed away it was protecting her, and that was what she was used to, right? And
Yeah.
those are the types of individuals that we serve, and we see that with their diagnosis. And at the end of the day, it was a new experience for someone to hold that firm boundary and say, I care about you no matter what. And that
Right.
was something she'd never heard before. um, I still have contact with this person.
Mm.
Every 3 months I get a phone call or a text. um, it's been more than 10 years now since I served her in that capacity. So I mean, those that we what we don't know all the time as a front line is how much those relationships that you're talking about and building those, how much they mean later
Yeah,
on, and how
for sure.
incremental growth can happen because of it.
Yeah. Yeah. And we see that all the time with individuals that are placed in the residential supports that we offer, where they, at a young age, for whatever reason, maybe the parents had gone to jail, they got into substance abuse, um, they ended up in a kinship or a foster placement,
Mm.
and we just see that pattern start at a young age. And yeah, I think it's having that awareness. Hey, listen, the way that they're treating you, there's a 15-year history here on why they got to that point. And and we have to be the ones that squash that for them. Meaning we have to be the ones that are consistent and that don't give up on them. And no matter what they do, we're going to be there till the end. And there's always that extinction burst that we like to say, where they'll push the limit, push the limit, push the limit, and they get to that threshold where, wow, this person has stuck through this more than anyone else. Maybe they are going to stick around and not give up on me. And so, yeah, I'd speak to that a little bit.
I have a question for you.
Yeah.
So, in terms of a clinical aspect and a clinical relationship from a therapeutic point of view, how do you teach that? How do you teach that to an RBT or a frontline PSR representative? How do you teach them that there is that next step?
Right. No, that's a great question. I think a lot of it is self-awareness. And so, in order to dive into someone's history and to try to bring up some of that trauma, and even at the front line, I think that's okay, so long that there's a relationship and a consistent pattern of longevity where you can explore that with them and help them understand, hey, listen, the way that you're behaving right now, you're breaking windows, you're aggressing, you're wanting to run away. What Help me understand, where is that coming from? And what is the feeling associated with that? What is the belief associated with that? And in a therapeutic setting, absolutely you would try to process that. But the challenge in a therapeutic setting is it's not in real time. And so when you're working as a direct care support staff, you can process those things in real time. Um, and and it's just bringing it to their awareness and helping them understand, hey, listen, I know you're doing this because there's something that you need and that you want. And this has served as a function for you to get that thing. And so let's identify what you need and what you want, and let's find another way for you to get that. And if you need space, if you need a break, if you're feeling overwhelmed, overstimulated, let's find a way for you to ask for that. Or let's find a way where you can get away and not be overwhelmed by the demands that are happening right now in a healthy way. If it's you needing to walk around the block, let's find a plan and let's work that in there. If you're wanting access to something, a phone um, or you're wanting to call someone, let's find a way for you to do that in a healthy way, um, instead of you having to run away and steal a phone or steal a car or, um, hit, kick, scream to get what you need and find another way to do that. There's different levels to that because there's different cognitive functioning. I mean, we work with a wide range of kids that have high support need autism, where they're not as verbal, where that approach would be different. But if they have, a moderate level of functioning where they can process that mentally, then I think that that would be a good approach.
I have another question for you.
Yeah.
So I'm wondering about what we talked about just a little bit ago with characteristics of those who are providing service and what makes a valued behavioral health employee. What does that look like? And I hear that compassion and empathy are really important in this field. And my thought is, how do you exhibit compassion and empathy without becoming too involved
Hmm.
and, emotionally becoming too involved as either a therapist or a frontline? Where's the balance? How does that work?
Yeah. Ooh, that's a good question because we see that often. We see people getting too invested, and they start to they start to push their boundaries, and it becomes almost an unhealthy relationship, right? You see rescuing happening, you see maybe gift giving and some other things that um, probably aren't a healthy way to interact. And so a lot of that is just learning healthy boundaries. And unfortunately, there's team members that need to learn that skill for themselves. And so, that's a whole other topic on boundary setting. What are healthy boundaries, and what does that look like? But if you have that skill, if you've learned to develop it, then you can have empathy and compassion while maintaining a firm boundary. Um, and so, yeah, I think these are skills that you learn from your own experiences. Um, and you have to know how to set a boundary for yourself so you're not getting taken advantage of. Um, but yeah, I think that we've seen team members come in, and for whatever reason, they lack that compassion and empathy. Maybe they're just not invested in the field, and that's okay. It's not for everyone. Um, and I think some of the characteristics that I've seen be successful are people that have gone through those experiences themselves, and they've been able to overcome those situations. And so there is that compassion because they've been through it. Um, a lot of times, if you haven't experienced anything or gone through any hard times or gone through trauma or abuse or gone through challenges that have really tested your perseverance and resilience, then you're going to face struggles in this field because trust us, the first month, 3 months in this field, you're going to be tested.
Yeah,
And,
absolutely. What other characteristics do you think are important? I'm thinking about the word problem solving because I think, um, in my own experience, I had a mentor many years ago, a leader that helped me understand that there's more than one way to solve a problem.
mm,
And I think in our field, I think we need to have individuals that are serving in other individuals that realize that and conceptualize that and know that.
mhm,
And they're not stuck on the method, but more of the message and
right.
not the method to get the message out.
Hmm.
And so, one of the examples that I had from my my mentor was, "Hey, would you be willing to take $1 million?" And I was like, "Sure, I'll take $1 million."
Hmm.
And he's like, "Well, would you take that $1 million if I gave it to you in $10 bills?" Sure, I'd take $1 million in $10 bills, no problem. And then he said, "Well, would you take that $1 million in, 5 months? And then for the next 5 months, you would have to, you know, do some extra things at work?" Yeah, sure, no problem. "Oh, well, if I gave you the $1 million, would you be willing to drive to Salt Lake to get it?" Yes, no problem.
Hmm.
So in every situation, my answer was yes, and I would take the $1 million. And I think he said to me, and this was in the field of home health and hospice. And he said, "That's how your nurses feel, Andy. Like
Hmm.
they are trying to say, we're going to get to the solution, but it might be in a different way than what you thought
Hmm.
or in that what you thought was possible." And so I think having that ability to problem solve and think outside the box and realize and actualize that it's the message that we're looking for and not the method to it.
Right.
And that always stuck with me. And I
Mhm.
thought if RBTs and frontline PSR individuals could understand that when they're working in this field, they need to focus on there is a program that we're following, and there are some skills that we're helping them to acquire, but at the end of the day there's different ways to get to that.
Yeah.
And at the end of the day, the goal is independence. So
Mm.
that's what we're searching for. That's what
Mhm.
we're helping to facilitate.
Right.
And if we're able to do that in a way that is different than what was thought previously, that's okay.
Yeah.
That's okay.
Yeah.
What other characteristics do you think
No,
are
that's a
important?
great point. I mean, we see that all the time, the rigidity and the inflexibility to look at the end goal and see that there's different ways to get there. And because we are all so different, we have different experiences and we've learned different ways to get to the same result essentially. So, um I think a lot of that is just learning a collaborative approach skill, learning how to work as a team and listen to others, and ultimately get to that point where we might be here, but let's get here because we want the same thing for this kiddo or for this individual, and because we want what they want, which is I don't know anyone that doesn't want to be independent and more self-sufficient. I think that's a natural desire that most people have. I could be wrong. And so with that being said, we know that they want to be self-sufficient and independent. There could be different ways to get there. So let's put all of our brains together and find out what what could what you've experienced that could be good, what I've experienced, and ultimately what works for the individual, because what works for me could be completely different than what works for them. um, and so we talk about that often, right? Just the client-centered approach and trying to take our ego out of it and identifying we all know what has worked for us, but what's going to work for them. And so what have you seen to be able to understand an individual and identify what works for them versus what has worked for us?
Yeah, I think it goes back to the relationship with them and identifying like a true knowledge of who that person is. And like you said, we're humans rendering human services. So there's fallacy there. There's error. There's complexities and different different parameters that make it so there's complex situations, right? So I think just being able to have a relationship, have a knowledge of that individual and how they learn. I mean, coming from a perspective of relationships in general, if I know someone really well, I'm going to also know perhaps how they'll react or how they will perceive a certain situation. So the better I know that individual, the more I'm able to help them to grow and to help them to achieve their goals. Um, and do it in a way that's meant for them. Like you said, it's individualized, and
Mm-hmm.
that's really what we do. That's what we do in this field is we individualize our service, um, because it's not a cookie cutter approach. That doesn't work,
Yeah,
right?
absolutely. Yeah, how many times do we hear that, oh, well, the company that I came from, they did it this way, and this is how it needs to be. And we've seen that become an obstacle for people trying to adjust their way of thinking and their approach. And it's just helping people understand it's okay. It's okay to look at other ways to do things. Um, and I think one thing that differentiates us from other providers is our experiential approach. A lot of times we see more clinic based services, kind of working in between four walls and trying to do work that way. And, we've taken more of an outdoor experiential approach, getting the kids outside of the clinic and experiencing things in the community. And sometimes that's weird for people. They're like, like it almost feels uncomfortable for them. Like, oh, is this a liability? Is this ethical, or whatever the case may be? Um, and so I think everything's a risk. Being in a clinic is a risk. Driving from your house to work is a risk. And so I think we can mitigate risk, but what what have you seen with experiential methods of training and helping individuals?
Just exactly what you said. I mean, the possibilities are endless. I remember working with an individual who is about 14 years old with autism, male, and really not getting anywhere in a clinic setting. But I got him out on a hike, and we hiked up to a waterfall, and all of a sudden I was hearing about his childhood, and I was hearing about things that are difficult for him and how communication with his sister was not working,
Mm,
and just some frustrations that he had expressed. And I was able to say, those are all skills that we can work on together.
mhm.
And I mean, at the end of the hike, I was like, why didn't I do this sooner?
Right.
Why did we wait for 2 months to
Yeah.
get him outside? So, I mean, being outside, being in nature, getting some physical exercise, having fresh air to breathe. This individual opened up and was able to, it goes back to relationships, right? The client's at the core.
Mhm.
And so that core relationship with him and I changed from that moment on.
Right.
And we would always say when we were having a difficult time during a session, remember Zion,
Mm,
because that's where we had that connection.
right.
Remember Zion. And
Mhm.
so we're on a hike, and when things would get difficult, I would just say remember Zion, and he knew exactly what I meant.
Yeah.
And so it just I have seen personally that working with a teenage boy in clinic didn't work so well, but
Yeah.
getting him out on a hike
Mm,
out in a beautiful national park,
yeah.
um, it changed our relationship from client to RBT.
Right.
So
And there's a way to justify that clinically. I think one of the concerns that people have is because we work through a lot of insurance payers, and the question is, well, insurance won't pay for that. Insurance won't pay for them to be on an activity. But clinically, there is a way to medically necessitate an outdoor experience that aligns with their treatment plan. And it all comes back down to treatment planning. What is the barrier? What are the goals? And what are the objectives to get there? And if one of the objectives is getting out in an outdoor setting and practicing that in real time, um, which is helping them move closer to their goals, then it's justified. And I think it's helping people understand that and see that it's that thing that you mentioned. There's more than one way to get somewhere, and um, and so I think with our approach here at Crimson being more experiential, we're going to attract people that need that approach. It's not an approach for everyone, but that approach that does work for kids and youth generally will be referred to Crimson, and it works well.
yeah, my thought is I'm thinking about what makes longevity in behavioral health. What characteristics do you see in therapists, clinicians, administration, or frontline that keeps them in a 10-year plus like
Yeah,
career? Like
right.
how do people do this for
Because we hear the
10,
word
20
burnout.
years?
We hear the word burnout often, don't
Right.
we? Is that your favorite word? Burnout?
Oh, or mental health day. But how are
Yeah.
they doing this day in and day out, over and like what have you seen, because you've
Yeah.
been in this industry so long, you've
Yeah.
worked in behavioral health so long, you've served individuals in a therapeutic setting. Like what do you see that makes people stick it out?
Yeah. And the reality is it is a high burnout industry, but it comes back to what we were talking about earlier, boundaries. You have to have that ability to separate work from personal life. Um, and you have to know how to set those boundaries and know how to take care of yourself, because ultimately, you know, our health is going to allow for that longevity. So it's figuring out what you love to do and separating yourself from work and being able to engage and do those things that you love outside of work. And then it's like the old saying says, I do what I love, so I haven't worked a day in my life. If you don't love the human service field, you can't force yourself to love it. And so, I think a lot of it is just that introspection. Is this for me? Do I really love helping people and changing lives, or do I want to create a Shopify account and sell Amazon because that's what satisfies me? And so I think it's kind of what we talked about earlier is we have experiences in our life that have shaped us for the industry and the field, and those experiences ultimately will create that longevity, I think. Yeah.
Absolutely. I think about it in terms of recognizing the wins and the whys, because if you know why you're doing what you're doing, it gives you purpose. If
Yeah.
you can recognize the small little incremental wins with your
Hmm.
client or with yourself, the reward, it's all worth it.
Yeah.
I remember working with an adult client who really had a difficult time. She was in her 40s, had autism, but had a difficult time with not only making eye contact, but just conversing with someone in a public setting, just being able to have a conversation with a store attendant or a cashier. It was so beyond debilitating for her, and she would have so much anxiety, and then usually a physical reaction would happen, like a seizure.
Hmm.
And so I remember working with this individual, and one of the things that we were working on together was her ability to ask for help. Because
Mm.
sometimes just doing that was the first step, but it was so difficult for her.
Mm.
And so we practiced and practiced for about 6 weeks, I want to say, a month and a half of different scenarios. We role played different ways to ask for help. And then she was ready. She said, I'm ready to do it. Let's put it to the test. So we went to the store, the grocery store. She was doing her grocery shopping, and she asked, or she noticed that there was something that she needed from the very top shelf.
Mm.
And on aisle 13 there at the grocery store, she looked at me and she said, "Oh, this is going to be the situation, isn't it?" And I said,
Mm.
"Yes."
Mm.
And I said, "So you're going to have to ask for help because you can't reach it.
Mm.
So what are you going to do?" She's like, she thought about it. She's like, "Okay, I'm gonna go ask one of the attendants." So she did. She asked a very tall man who was probably 6'2".
Mm.
Um, I need a box of macaroni and it's on the top shelf. Would you be able to get it for me? And I just remember, this is silly, but I just started kind of tearing up because that was something that she said she hadn't done for about 5 years. And she hadn't felt confident enough or had the skills communication wise to do what she just did.
Mm.
And I remember the gentleman gave her the box of macaroni, and then he looked at me and I'm tearing up and she was smiling, and he's like, "Okay." But those small incremental wins, that particular win, I go back to that all the time when I'm having a rough day. Like, all she had to do was say, "Can I have a box? Can you help me reach it? Because I can't." And all she needed to do was to have someone help facilitate that experience.
Mm.
And the next time she went to the store, she was going to ask for help out to her car with the groceries, with her, being able to carry them. And so it just was the smallest of things. But I think in this field, we have to recognize the smallest of things
Mm.
because they don't come in big, huge, change, monumental
Right.
experiences.
Yeah.
I mean, that's, the world of behavioral health.
Yeah.
It's small incremental changes
Right.
that get us there. So that's something that I think about all the time. Is just those small little, and being able to recognize that, it gives us that, oh, this is why I'm doing what I'm doing. This is
Yeah.
the why. This is the reward at the end of the day. And being able to recognize that and see that is not for everybody. I mean,
Yeah.
some people could look at that situation and go, that's not that big of a deal. That's not a big win. But for me and for that individual that day, it was.
Yeah.
So,
Absolutely. No, I love that. And I think everyone has their different whys and purposes, but in behavioral health, the why and purpose comes back to the same thing. We want to help people overcome and conquer whatever they're going through. I mean, this particular individual, it sounds like she had some type of chronic or mental health condition that really impeded her functioning in the real world. And those things are sad to see because they can debilitate people and affect
mhm.
their lives and their relationships with their kids. And that's a big motivator for me is seeing, I mean, I've seen so many times kids, youth that were overlooked and didn't receive the care that they needed soon enough, and the outcome wasn't positive. I've seen kids take their lives. I've seen suicide. Um, I've seen people slip into substance abuse, end up in jail, and so we know we've seen worst case scenarios, and that that drives me because I want to do everything in my power to help them choose a different path, and being able to be involved in that process and see, hey, this is how it was going, but now you're here. That's an incredible feeling, and it's rewarding, and it comes back around. And so I think it's kind of having like a broad macro perspective too, because I believe if we could get to a point where we could help everyone change the trajectory of their life from going into the depths of despair to being a productive, successful citizen in the community, I think it's changed the world. It would change society. It would change our communities. So, um, I mean, for me, big picture, that's what I love. I love visualizing and thinking of a world where we don't have so much pain and despair um, and it's unavoidable, but I think we can assist and help it be better.
Yeah,
So
1% at a time, right?
yeah,
Absolutely.
for sure.
Anything else?
No, I think that's good. Okay, cut.